In 2032, something will happen in the United States that has no precedent in modern American history. The Social Security Trust Fund will exhaust its reserves. Not in theory, not in political debate. According to the official projections of the Social Security Administration, the largest retirement program in the world will run out of money in approximately 7 years. But here's what matters more than that date. The crisis driving that date is not coming. It's already here. It's already reshaping the American economy, the job market, healthcare, and the retirement prospects of millions of Americans. Most people just haven't noticed yet. This is the story of America's demographic time bomb. It is the fundamental restructuring of the nation's population. Too few workers, too many retirees, and a social contract designed for a world that no longer exists. It's a crisis that is entirely predictable, with a timeline that is mathematically certain, and yet it remains largely unspoken in the halls of power. The question is no longer whether this crisis exists. The question is what happens when Americans finally understand what it means. America is aging. This simple statement contains within it the most significant economic challenge the nation will face in the next 2 decades. In 1960, when the U.S. Social Security system was fully operational, there were approximately 5 working-age Americans for every person drawing a Social Security check. 5 workers, 1 retiree. That ratio made the entire system viable. It made promises possible. It allowed politicians to make commitments they could actually keep. Today, that ratio stands at 3 to 1, and it continues to decline. The statistics paint a portrait of profound demographic transformation. In 2026, the United States has 71.6 million citizens aged 65 and older. By 2030, a span of just 4 years, that number will swell to approximately 82 million Americans. That represents a 14.2% increase in a single 5-year period. This is not a prediction about the distant future. This is happening now. Simultaneously, the working-age population, Americans between 20 and 64, is growing at 0.1% annually. For practical purposes, this is zero growth. The workforce is stagnant. The implications are staggering. As retirees accelerate into retirement, the pool of workers to replace them shrinks. The system is experiencing what demographers call an inverted pyramid. The foundation is crumbling while the weight on top grows heavier. By 2032, a watershed moment will arrive. There will be more Americans aged 65 and older than children under the age of 15. For the first time in American history, the elderly will outnumber the young. A society that was once built on youth, on growth, on an expanding workforce, on new generations entering the labor market, will become a nation of aging citizens and diminishing workforce capacity. The regional variations in this crisis tell an even more dramatic story. Maine, the oldest state in the nation, already has an average age of 45.6 years. Texas, by contrast, remains relatively younger. Yet even Texas will have 5.4 million residents over 65 by 2030. That single-age cohort in a single state will exceed the entire population of Colorado. This is the scale of demographic concentration happening across America. The trend is inexorable. It cannot be stopped. It can only be managed. For nearly a century, Social Security has been the bedrock of American retirement security. It has evolved from an emergency Depression-era program into the primary income source for tens of millions of seniors. Over 90% of Americans aged 65 and older receive Social Security benefits. For many, it represents the difference between survival and poverty. The program's mathematics are straightforward, even elegant in their simplicity. Current workers pay a payroll tax. That tax pays for current retirees' benefits. When enough workers are paying relative to the number of retirees receiving, the system stays solvent. When that ratio deteriorates, the system faces a shortfall. The deterioration is now acute. In 2021, Social Security crossed a critical threshold. Benefit payments exceeded payroll tax revenues for the first time since 1982. The program began drawing down the trust fund reserves, money accumulated over decades, to cover the gap. The Social Security Administration has been precise about what happens next. The Old Age and Survivors Insurance Trust Fund will be exhausted in 2032. That date is certain. It is not subject to political interpretation or economic fortune. It is a mathematical certainty based on demographic trends that are already baked into the system. What happens when the trust fund is depleted? Social Security does not vanish. The program will continue to collect payroll taxes from workers. Those revenues will continue to flow to retirees. but the revenue is insufficient to pay the full benefits that have been promised. The gap is substantial. If Congress takes no action, if it passes no reforms, raises no taxes, cuts no benefits, then beginning in 2032, Social Security will only be able to pay approximately 80 cents for every dollar of promised benefits. For the average American retiree receiving $2,081 per month, this translates to roughly a 20% reduction in income. For millions of seniors living on the edge of poverty, a 20% reduction is catastrophic. The magnitude of the shortfall is almost incomprehensible. Over the next 75 years, Social Security faces an unfunded obligation of $26 trillion. That is not a misprint. Trillion. It represents the gap between the promises made and the revenue available to keep those promises. Yet Congress has options. Policymakers understand the crisis. They simply have not yet been willing to make the hard choices that solving it requires. The solutions are painful. They are mutually exclusive, and they must be chosen soon. One option is to raise the payroll tax. Currently, workers and employers each pay 6.2% in Social Security taxes on income up to $184,500. Raising that rate by roughly 21% would close most of the funding gap. Workers would pay more. Employers would pay more. Wages would effectively decrease for everyone in the workforce. Another option is to raise the retirement age. Currently, full retirement age is 67 for those born in 1960 or later. Moving it to 69 or 70 would reduce lifetime benefits for all future retirees. People would have to work longer. Some workers, especially those in physically demanding professions, would find that impossible. A third option is to reduce benefits. Benefits could be cut across the board. Benefits for higher income earners could be reduced. The cost of living adjustment could be scaled back. In every scenario, retirees receive less than they expected. Or Congress could implement a combination of all three: higher taxes, later retirement, and smaller benefits. This is likely what will ultimately happen. And when it does, Americans in all age groups will experience the consequences. This is not a problem for 2040 or 2050. This is a problem for 2032. It is 7 years away. The aging of America creates cascading consequences throughout the healthcare system, and those consequences are accelerating. Older Americans require more healthcare. This is not speculation. It is biological reality. Chronic diseases proliferate with age. Hospital visits increase. Medication needs multiply. And as the number of Americans over 65 swells toward 82 million, demand for healthcare services becomes overwhelming. But here is the problem. America does not have enough healthcare workers to meet this demand. Consider nursing. In 2026, the unemployment rate for registered nurses is 1.6%. This is effectively full employment. There are virtually no unemployed nurses available to be hired. Every single nurse who enters the profession is immediately absorbed by the system. Yet projections for 2032 show that the United States will need an average of 193,100 new registered nurses annually. This is not total employment. This is new hires per year. Nurses needed to replace those retiring and to expand capacity to meet growing demand. How many nurses does America produce annually? Significantly fewer than 193,100. In the decade between 2022 and 2032, the U.S. is expected to graduate approximately 177,400 nurses total. That is enough to meet less than 1 year of projected demand across a 10-year period. The nursing shortage will only deepen. The situation in primary care medicine is similarly bleak. The American Medical Association estimates that 83 million Americans currently lack access to a primary care physician. Not in 2035. Not in 2045. Right now, the shortage is acute and immediate. Teaching more doctors takes time. Medical school is 4 years. Residency is 3 to 7 years additional. A physician trained today will not be practicing independently until 2033 or 2034. Meanwhile, demand is already outpacing supply. The crisis extends beyond nursing and medicine. Home health aides are desperately needed. Physical therapists are in short supply. Geriatric specialists, doctors who specialize in care for the elderly, are almost non-existent relative to need. America is facing a comprehensive shortage of healthcare workers in almost every category. Now consider the financial dimensions of healthcare in old age. The average American entering retirement faces substantial healthcare costs. Medicare Part B premiums run $202.90 per month. Part D prescription coverage averages $40 to $80 monthly. Copays and coinsurance persist across all services. Dental care, hearing aids, eyeglasses, Medicare covers none of these. But the truly catastrophic costs come from long-term care. The median cost of a private room in a nursing home is now $376 per day, or approximately $11,294 per month. A year in a private nursing home costs $135,528. A 3-year stay costs over $406,000. A 5-year stay costs $676,000. Medicare does not cover long-term nursing home care. This is a point of profound confusion among seniors. Medicare covers up to 100 days of rehabilitation care following a hospitalization. After that, it covers nothing. Long-term custodial care, the kind most nursing home residents actually need, falls entirely outside Medicare's scope. For those who cannot afford to pay privately, Medicaid offers coverage. But Medicaid requires asset depletion. Applicants must reduce their life savings to near zero before qualifying. Medicaid typically pays for shared rooms rather than private rooms, meaning seniors must surrender privacy to access coverage. And to qualify in most states, monthly income cannot exceed approximately $2,982, less than the average Social Security check. This creates an impossible choice for millions of middle-class Americans. Work a lifetime, save diligently, build modest wealth, then face one medical crisis, a stroke, dementia, heart attack requiring institutional care, and watch that lifetime of savings evaporate in 3 or 4 years of nursing home expenses. The financial dynamics are brutal and unforgiving. An average couple might accumulate $500,000 over 45 years of work. A single extended illness requiring nursing home care depletes that in fewer than 5 years. The transfer of wealth from families to healthcare institutions is systematic and total. Fewer workers and more retirees combine to create a labor shortage that extends far beyond healthcare. Construction companies cannot find enough workers to meet demand. Housing cannot be built fast enough. Infrastructure projects stall because skilled trades workers are simply unavailable. The typical construction worker is aging. Not enough young people are entering the profession. Manufacturing faces a similar crisis. The sector is expecting 2.1 million job openings between now and 2030. But the available workforce, especially workers with the technical skills manufacturing demands, is insufficient. Vocational education declined for decades as policy pushed everyone toward 4-year college degrees. Now the bill comes due. We need welders, machinists, electrical technicians. We train them for college instead. Teaching is experiencing an exodus. The typical teacher is aging out. Schools struggle to recruit. Teacher salaries have increased more slowly than the broader workforce, particularly for younger teachers. Young people with the education to teach look at salary prospects and choose other fields. In accounting and finance, approximately 75% of practicing accountants are near or at retirement age. Yet the number of people taking the CPA exam has fallen to a 17-year low. The pipeline is broken. When these accountants retire, who replaces them? The pattern is consistent across sectors: an aging workforce, insufficient numbers of young workers entering the field, and critical skill shortages in almost every sector that sustains the economy. This creates a vicious cycle. Employers raise wages, trying to attract scarce workers. Higher labor costs raise prices for consumers. Inflation accelerates. Young people find it harder to afford homes, to start families, to invest in their own futures. Birth rates, already low, decline further. The demographic crisis deepens. Meanwhile, immigration, which has historically supplemented the American workforce with young, working-age people, has been restricted. Between 2025 and 2026, federal enforcement efforts against undocumented immigrants and humanitarian status holders sharply reduced the available immigrant workforce. The working-age population, already stagnant, contracted further as a result. The United States faces a structural labor shortage. It is not cyclical. It is not temporary. It will worsen for the next 15 years as baby boomers complete their retirement transition. No single policy fix addresses this comprehensively. The shortage is a direct consequence of demographics, and demographics are destiny. The demographic crisis is not an abstract problem for policy economists. It is reshaping the concrete realities of American life right now. For those in the workforce, the labor shortage has mixed implications. Wages are rising in many sectors as employers compete for scarce talent. But that advantage is temporary and fragile. As labor force participation continues to decline, economic growth will slow. Job creation will decelerate. Career advancement will become more competitive. More immediately, workers face the prospect of higher taxes. If Congress elects to close the Social Security funding gap by raising the payroll tax, working Americans will see their paychecks reduced. If current projections hold, a tax increase of roughly 21% will be necessary to restore solvency. For a worker earning $60,000 annually, that translates to approximately $1,550 in additional annual Social Security taxes. This is not hypothetical. This is the range of options on the table. For those approaching retirement or already retired, the stakes are even more direct. Social Security benefits hang in the balance. A reduction of 20% is not a minor adjustment. For the millions of seniors living on less than $2,500 monthly, a 20% reduction is the difference between affording rent and homelessness. Healthcare costs will continue to escalate as demand outpaces supply. Medicare premiums will rise. Out-of-pocket costs will increase. The burden of healthcare in retirement will be far heavier than most Americans expect. Long-term care planning becomes essential. Yet most Americans have done no planning whatsoever. They believe Medicare will cover nursing home care. It will not. They expect their savings to be sufficient. For most, they will not be. They assume family members will provide care. Modern family structures often make this impossible. 10b-0, the regional disparities mean that the crisis will hit different parts of America with different intensity. States with aging populations, Maine, Vermont, New Hampshire, West Virginia, will experience acute labor shortages, higher service costs, and fiscal stress as the tax base shrinks and demand for public services swells. Younger, growing states like Texas, Arizona, and North Carolina will experience rapid growth in their elderly population, requiring massive new investment in healthcare infrastructure, housing, and social services. They will face congestion and cost pressures, even though they are not experiencing overall population decline. While the economic effects are no less. Economic growth depends on three inputs: labor, capital, and productivity. When the labor force shrinks, growth becomes harder. At the national level, economists are projecting slower economic expansion in the coming decade compared to historical averages. The Congressional Budget Office and major forecasters expect GDP growth in the range of 2% annually, below the long-term historical average of 2.3%. Some forecasters warn of stagflation light, sluggish growth coupled with persistent inflationary pressures. Why stagflation? Because fewer workers producing goods and services at the same time healthcare and retirement costs soar for a larger population creates an inherent inflationary dynamic. Supply constraints, fewer workers, combined with demand pressures, more retirees consuming services, naturally drive prices upward. The sectors that will contract are those dependent on young, growing populations, residential real estate, consumer goods, technology, innovation. The sectors that will expand are healthcare, elder services, certain types of infrastructure maintenance. Stock market valuations will feel pressure. Fewer workers means slower earnings growth. Slower earnings growth means lower stock price multiples. Retirees who depend on investment income will see that income decline even if stock prices don't fall. Housing dynamics will shift. First-time homebuyers will face continued affordability challenges as the average age of the population increases and demand for single-family suburban homes peaks. Multifamily housing for younger Americans will face structural demand issues. Meanwhile, demand for senior housing will soar, creating regional mismatches between available housing and where people want to live. The fiscal position of the federal government will deteriorate. Social Security, Medicare, and Medicaid, the three largest government programs, will all face funding pressures. Decisions about taxes and spending will become unavoidable and painful. Every option chosen will impose real costs on real Americans. The crisis is real. The timeline is certain. The options are limited. One path forward is to raise taxes immediately. Higher payroll taxes, higher income taxes, or both. The advantage is that the burden is distributed gradually over time. The disadvantage is that it requires an immediate reduction in the take-home pay of every working American. Another path is to reduce benefits. This could mean raising the full retirement age to 69 or 70. It could mean means testing benefits so higher-income retirees receive less. It could mean reducing the cost of living adjustment. The advantage is that workers are spared tax increases. The disadvantage is that future retirees receive less than promised, and some workers may be unable to work until age 70. A third path is to increase immigration. More working-age immigrants would expand the tax base, increase the worker-to-retiree ratio, and help address labor shortages. But immigration is deeply controversial. It requires political consensus that currently does not exist. A combination approach is almost certainly necessary. Higher taxes for some, later retirement ages for some, benefit reductions for some, and likely some increase in immigration. The pain is distributed, but pain there will be. What is not an option is doing nothing. The mathematics do not allow for that. In 2032, when the trust fund is exhausted, the automatic benefit reduction will occur unless Congress has already acted to prevent it. That reduction will happen. Either Congress chooses how it happens, or it happens automatically. There is no third option. Understanding this is very important for every American. For those still working, the first imperative is to save aggressively. Social Security will likely be smaller than currently projected. Retirement savings must compensate. Financial advisors universally recommend that retirement savings be substantially larger than most Americans currently accumulate. This means building wealth while still in the workforce. A challenging proposition given inflation and housing costs, but essential nonetheless. For those approaching retirement, the decision about when to claim Social Security becomes critical. Delaying Social Security from age 67 to age 70 increases the annual benefit by approximately 24%. For some, this is the difference between a sustainable retirement and financial stress. Working a few additional years may be necessary and beneficial. Healthcare planning in retirement becomes paramount. Understand what Medicare covers and what it does not. Understand the costs of Medicare supplements. Plan for long-term care, either through insurance or through ensuring sufficient savings to cover it privately. For those already retired or near retirement, it is not too late to adapt. Downsizing housing can release substantial equity. Working part-time in retirement can reduce the demand on savings while maintaining engagement and social connection. These are not default options for everyone, but for many, they represent critical flexibility. For young people, the message is different, but no less urgent. Build diverse skills. Pursue careers in sectors with real demand and growth prospects. Healthcare, skilled trades, technology, education. Do not assume a defined benefit pension will be there. Assume responsibility for your own retirement savings from the beginning of your career. Understand also that the economic and political constraints facing the nation will affect your life. Social Security might be smaller. Taxes might be higher. The cost of living might be more volatile. Flexibility, adaptability, and resilience matter more than ever. The demographic crisis will reshape America geographically as well as economically. Rust Belt states that have already experienced population losses will face accelerated decline. Younger people are already migrating away, seeking opportunity. As aging accelerates, the tax base shrinks, public services decline, and the regions become less attractive to young families. A downward spiral can develop. Sunbelt states that have attracted retirees for decades will face the opposite challenge. Rapid growth in the elderly population, straining housing, healthcare, and infrastructure. Florida already struggles with insurance costs and climate risks. Adding 2 million elderly residents compounds these pressures. Heartland states with large agricultural and manufacturing sectors will experience acute labor shortages. Small towns, already struggling, will find services disappearing. Healthcare access will become worse. Educational opportunity will decline. These regions will become increasingly dependent on subsidies and transfer payments from the federal government. Metropolitan areas with diverse economies and younger populations, parts of the Northeast, California, Texas, Colorado, will likely fare better. They have the economic base to adapt. They attract younger people and immigrants. They have capacity to absorb demographic change without catastrophic decline. But even in thriving metros, services will cost more, growth will slow, and the fiscal pressures will be felt. There is no region that escapes the consequences of aging and declining workforce growth. The effects are simply more acute in some places than others. The demographic time bomb is not a future crisis. It is happening now. The decisions made in the next 2 to 3 years will determine whether the transition is managed with relative grace or whether it occurs chaotically with severe consequences for millions of Americans. If Congress acts soon, raising taxes, adjusting benefits, and supporting immigration reform. The adjustment can be gradual. The burden can be distributed. The pain can be managed. If Congress delays, the adjustment will be sudden and severe. In 2032, when the trust fund exhausts, either a massive tax increase takes effect immediately or benefits are cut automatically. Neither option is politically feasible without advanced planning and public understanding. The time for education, for honest conversation, for deliberate planning is now. That time is narrowing. In 5 years, the options will become more constrained. In 10 years, they will become impossible. This report exists to communicate that reality clearly. The crisis is real. It is large. It is coming. And the time to address it with grace is running out. A century ago, the United States faced a similar moment of demographic and economic crisis. The answer was Social Security, a social insurance program that protected the elderly from destitution. That solution has endured. It has reduced senior poverty from 35% to under 10%. It has provided dignity and security to tens of millions of Americans. Now, that program itself faces an existential challenge. The question before America is not whether to preserve Social Security. The question is how. What combination of taxes, benefits, retirement age, and immigration will sustain the commitment to elderly Americans while protecting workers and the broader economy? That question demands answers. It demands honest conversation. It demands courage from political leaders willing to make hard choices. The demographic time bomb is ticking. The math is relentless. The deadline is real. The only variable that remains is how Americans choose to respond.